Hey y'all, welcome back to another video. If this is your first time tuning in, thank you for watching. And if you're a return viewer, thank you for watching and welcome back. Also, if you're new to my channel, don't forget to hit that subscribe button. Today y'all, I wanted to come on and tell y'all, just pretty much talk about what I keep in my nursing bag. This video is going to be titled What's in My Nursing Bag, Hospital ICU Edition, but really it could be tailored toward any specialty. I'm an ICU nurse, so that's what my bag is tailored toward. And I also do agency, which is like skilled nursing facilities and long-term care, but we'll talk about that a little bit more. But without further ado, let's get into the video. So I made a little list of things just so that I don't forget to mention something. I lost my shoe there, y'all. Okay, so first I'm gonna start off with my bag. I carry a Boggs bag. When I first started nursing, I did the whole little, it kind of looks like a duffel bag. Every nurse has had it and you can get a monogram. And I still will carry that from time to time, but I more so save that for my loans when I'm working agency for specific reasons. But right now I'm carrying a Boggs bag, and this is in the color hot pink, and this is the medium size bag. They have a very large bag. It looks like a beach tote. I chose this bag specifically because it has the same feel as a pair of Crocs, so it does not weigh down my shoulders. So when I put it on, I don't get that weigh down on my shoulders, and then it makes my back hurt. It's very lightweight, and also I can wipe it off. So I wipe this bag off before I bring it home, which is why I don't mind it sitting on my bar. And it's pretty spacious, y'all. It bends, so it accommodates everything. It molds to what's in your bag. And then it has like a little pocket in the inside that I keep small things that I want to be able to reach easily. Okay, so let's start off with what's in my bag. Obviously, I always have my badge in my bag. I'm not going to pull that out and show it just for privacy purposes. But what's in my bag is, we're going to start out with a report book. I have a report book. I was given this book when I very first came onto the ICU unit, and it has report sheets in it that are, you can fill it out, and we take these and we make copies of them when we get low, and then we take it to like Office Max and get it spiraled. And y'all, it is so helpful. Like, so if I'm doing a 3-day stretch, when I come back, if I'm getting my same patient back, I can just get an update because I already have the rundown on the patient. And also it's great for new grads because if you don't know what questions to ask and report, you can pretty much go by this, because most of our nurses use this as well. So they follow this and they're telling you information based off of this, like going through a review of systems, GIGU, what lines they have, what drips they have. So if you're following along and you notice they didn't tell you anything about their labs, you can look at your paper and see you have nothing written down for labs. So you kind of know what questions you need to ask. And I think that's a major part of being a new nurse is a lot of nurses struggle with report because they don't know what to ask, or they don't know what they should be saying. Like, so they end up, just rambling about nothing, and the nurse is annoyed, and at the end of the report, they feel like they haven't either learned much or they haven't told the nurse what they should be telling them. So this is a great guide for that, y'all. I make sure that I have this. I feel like I can't even function without my report book. So that's number one on the list. I also have a folder. In this folder, I keep maybe a printout of certain hospital policies. For example, an ECOS. If you have a patient that's on ECOS, there are certain policies and procedures that have to be followed, and I want to be able to access it readily, make sure I'm hitting step by step on that policy. So this is a book of like hospital policies that I want to have at hand. I also keep this book. I started out, when I started in ICU, I started with this book, and this was just a book that my preceptor, she actually made a printout for me, and it was like a flow sheet of what my day should kind of flow like the things that I definitely should be doing, things that I should be charting on, and how often I should be charting. So it kind of helped me, it did help me a great deal once, when I was in orientation, and she kind of let me do my own thing, and then she would just check behind me, so I could follow by this and I would know exactly what I should be doing. Like, did I chart oral care? Did I do this? Did I chart on this? And so I could check behind myself before telling her, like, okay, you can check behind me now. So I keep that, and now I have precepted new nurses. So I've been a preceptor, and I make a copy of this and give it to my preceptees. Also in this book, y'all, listen, I have attachment issues to this book because in this book, when I first started, look at it, look how raggedy it is, y'all. When I first started, I wrote down like all the blood administration steps, like what I need to have done before I go to the blood bank, what I should be checking for, what I should be looking for, what to take with me. And now I don't need this. I don't need it, but I feel like I need it, if that makes sense. Like I make sure I have this, and I will still reference this when I'm getting ready to hang blood. Like no matter how confident and certain I am, I always check that checklist again. I also have like things written down, like if I'm going to get a stroke patient from the ER, what to expect, what I should do to prepare, what questions I'm going to ask that patient, what paperwork I need, you know. So I keep this with me, y'all, and I don't care what can't fit in here. This is going to fit, and it's falling apart, but it's still with me. Okay, judge your mama. Okay, and I keep y'all, this is my stethoscope. This is a hot pink stethoscope. This, I have had this stethoscope for years, and it's got some blue dye that has kind of faded off on it. This is just a plain MDF stethoscope, but I get so many doctors and nurses that'll pick this up to use, and they're like, man, you can hear everything on it. I don't feel like it's all that great, but it'll do. However, I had retired this stethoscope, y'all. I bought a new one, a matte black one, and I loved it. It was so cute and so sleek, and somebody stole it from the unit. And just when I thought that I was going to throw this one away, I ended up having to go back to it because as a nurse in ICU, you cannot work without your stethoscope. And if you do, I don't know how you're doing it, but it ain't for me to judge you. Anyway, so that's what I have, a stethoscope in my bag, of course. Y'all see, all this stuff fits in here perfectly. I keep a scrub cap in my bag. This is one that I got from Amazon. It is satin lined, y'all. And it's great. I'm a wig kind of girl, but y'all know that by now. So if my lace is not looking the best or my hair is not laid, I will definitely put this on and put my hair up. Or even if I might start the night off with my hair down, but as the night progresses, y'all know how it is. You coding people, you running, you working. I'll put my hair up in there, and it just, to me, is out the way. I also will keep a stretchy. In my bag is my glasses, because your girl is getting older and I can't see. So depending on where I'm sitting in the unit, I need to be able to see the space labs to see what my patient's heart rhythm is doing. If I'm sitting here and the space labs is up here, I can see my patient's vitals on the screen without being in their room, as long as I have my glasses on. If I don't have my glasses, I can't see. So I'll make sure I have those. I keep an umbrella for unpredictable weather. I keep a critical care pocket guide. Y'all, I got this from Amazon for about $30-something. I saw a lot of people on my unit with this, and I would look through it, and y'all, it has, oh my gosh, this is like a critical care class all over again, but it's condensed. So if I get a patient that I haven't had in a while with the issue that I haven't had, or something going on with their GI/GU system or their heart, I can always go in here and find the condition. It'll tell me like what to expect. What should I, be seeing in that patient? What type of treatment is, usually rendered for that patient? Labs that I might see, and it's just great, y'all. And it covers so much stuff. You can wipe it off. It's waterproof. You can write on it. So that's what I love about that, and I will reference this a lot. I keep a pen pouch. In this pen pouch, I keep a Sharpie, because you always writing on stuff. You need to label your lines. In ICU, I label all of my lines. I don't got time. I keep a highlighter to highlight important stuff on my report sheet that maybe I may forget, like a lab or something. And I keep a pen. I keep one of these pens. This is a multicolored pen. I'll start off my 3-day stretch writing in black. Day 2, I'm writing in a different color, preferably blue. But by day 3, I'm writing in red, because it's an emergency. I'm ready to go. I done had enough. Like, everything is in red. Like, and that to me, that signals like, this is my last day of my stretch, and this is my last time with this patient. So I always have that. But I have backup pens too, just because you can never have enough pens. And I don't take my good pens to work, because nurses, we steal pens, and we don't mean no harm, but it's what we do. It's our thing. I keep a mini bottle of spray, like body spray, body mist, and a hand lotion, because being in the hospital, you smell so many different smells, and sometimes I feel like they get stuck on my clothes or whatever the case may be, or in my hair, and I might go to the bathroom and just kind of freshen up. And I keep some hand lotion because I'm constantly washing my hands. So I keep this, and it's scented very light. It's like a, this is Warm and Cozy by Pink, y'all. This is a very throwback smell, but I like it because it's light. It's a soft vanilla and toasted coconut, so it's not overbearing on the patient or whoever I'm caring for. Remember I told y'all how accommodating this bag was? So it has a little pocket thing in here, and inside of that little pocket, it's a little clear pocket, I keep my AirPods, I keep some gum, because I'm always talking. I talk for 12 hours, so sometimes your breath gets dry, and I'm always talking to people, so I always want my breath to be fresh. And I keep a personal hand sanitizer for if I go down to the cafeteria, I might just want to sanitize my hands myself. I keep a lip oil that adds a little gloss to my lips. I keep a lip balm. This is an EOS lip balm. I'm not sure what flavor it is. It's like watermelon mint or something, but it's very hydrating. It doesn't leave my lips sticky. And I told y'all I keep a hair tie to pull my hair back. And all of that fits in that little thing. And I also keep my charger in here, y'all, but I'm using my charger at the moment. Last but not least, y'all, I keep my little grab bag in here. And this, I call it a grab bag because that's just what it is. And inside of this, I keep it very minimal, y'all. I have my green tea. Y'all know I love my teas. I drink green tea about 4 a.m. I'm not a coffee girl. I drink my tea. And I have my cinnamon sticks that I put in my tea. I keep a bag of popcorn for if I want something to snack on. I keep some feminine hygiene products in here, and I try to keep something whether I need it or somebody else may need it. I keep a little honey pot wet wipe in here in case you want to freshen up or anything. And then I have a little medicine baggie in here. And I will, these are ibuprofen in here now because, I mean, you would think in the hospital you would have access to the basics, but you don't. So I'll keep ibuprofen in here. Normally, my main thing is like ibuprofen and an allergy medication. Because for some reason, I don't know if it's the air in there or just all the germs, my allergies tend to act up in the hospital. But right now, I just have ibuprofen in here. And I will switch this out and kind of alter it depending on what I need. But my tea stay in here. Y'all, and that's all that I keep in my bag. I was not going to add anything to this bag to make y'all think that I'm more put together than I am, because I'm a minimalist kind of girl when it comes to this thing. At my very seasoned era of a nurse, when I first started out nursing, of course I was that nurse that I had a lunch bag, I had a work bag, I probably had a book bag, and it's just too much because I don't use all that. So now I just use what I have in my bag is what I need to get me through my shift. So it's really my essentials. I don't carry a water bottle like one of the tumblers and stuff. I don't carry that because 9 times out of 10, I'm too busy to drink a whole thing anyway. My unit always has fresh water and ice on the unit that is unlimited. We have juice, sodas, and all that, so I don't feel the need to bring in extra water when I have water. I don't drink coffee, so I drink my hot tea, and I make that on the unit because, again, the supplies are there. I don't bring a lunch bag because I eat at work. Even though I work night shift, my hospital opens up the cafeteria and the veranda, and they cook every single night for us for 3rd shift. So I eat there. I snack there. Anything I can do to cut down the amount of things that I am carrying, that's what I do. I was not gonna put on scrubs to do this video. Y'all gonna get the real and the raw. When I first started nursing, I was that girl. I couldn't wait to put on scrubs, honey. I would put them on and then want to take them off. I wanted everybody to see me in my scrubs. Nowadays, I'm at work and I can't wait to take my scrubs off. I think it's a comfort thing. I don't know if y'all the same way or not, but I like to be comfortable, and scrubs is not my happy place. Y'all, also, I wanted to thank y'all for 200 subscribers, y'all. It means so much to me, and I know that it's small. to some people, but that is very big to me. I'm very thankful. I'm very grateful. My first video, which was my 8-month update as an ICU-RN, has over 5,000 views on it, y'all. I want to thank y'all so much. I'm so grateful, y'all. So to show y'all how thankful I am for y'all, I'm going to be doing a 200 subscriber giveaway, even though I'm a little over 200 subscribers now, but y'all just been moving quicker than what I could keep up with. I am going to do a 200 subscriber giveaway. In order to enter the giveaway, you have to do 3 things. Number 1, you have to be subscribed to my YouTube channel. Number 2, you have to be following me on Instagram. My Instagram is linked below, and if you don't see it, it is Neek_Rose. And number 3, you have to share this video. You have to screenshot, send me proof that you're subscribed and that you are following me. I'm going to be picking a winner. Today is Friday. I'm going to pick a winner 1 week from today. There will be 2 winners. I'm going to pick 2 winners. The first winner will get an Amazon gift card, and the second winner I'm going to give away a bottle of perfume from. When I choose my person, I will reach out to you on Instagram, and I will give you the option to choose from 4 to 5 fragrances, and you choose your pick, and we will go from there, and I will get you your gift. Y'all, again, I want to thank y'all so much for sticking with me, rocking with me. I'm new to this, so I'm still learning. I read y'all comments and I talk back. Anyway, y'all, if you made it this far through the video, be sure to like, comment, share, and subscribe, because why didn't you subscribe, sis? Anyway, thank y'all for tuning in, y'all. Leave your questions and comments, anything below. Bye, y'all.